My name is Tarek. I'm a third year medical student at UTHSC in Memphis, and I'll be giving a presentation on radiogenomics. So, the term radiogenomics was originally used in 2002 by a researcher named Christian Andreasen, and this term originally referred to being able to analyze a patient's genetics, and then based on those genetics, how would the patient respond to radiation treatment? So, would they be more likely to have complications, or would they be more likely to respond to radiation treatment? Today, though, radiogenomics has shifted into becoming a much more high-tech modality that is more applicable to the modern field of diagnostic radiology and medicine. Today, radiogenomics more so refers to being able to tell a patient's genetics just based on an image alone. So an example of that would be like being able to tell that breast cancer is HER2 positive just based on MRI findings. So two large discoveries really led to the modern idea of radiogenomics. First off, the Cancer Imaging Archive, which analyzed a subset of approximately 10,000 patients, and it reviewed all of their imaging and linked specific imaging findings to specific cancers. Then the Cancer Genome Atlas looked at these same subset of patients and linked certain histological findings to these same cancers. And through these two studies, they were able to link certain radiographic findings and histological findings together. And so some examples of this are like the IDH1 mutation overall looking less aggressive and having distinct shapes on MRIs, or MRI enhancement patterns that correlated with certain receptor status in breast cancer. And so how does really all of this work? How are we able to link these imaging findings to histological findings? Well, the process is done through radiomics, which is the backbones of radiogenomics. So this is the process of extracting quantitative features from imaging that is not readily seen by the human eye. So something like border irregularity or speculation can be seen by the human eye and can be also quantified by a computer. But other things like entropy and skewness, which cannot be seen by the human eye, can be represented through pixel intensity in an image, and these can also be quantified by a computer and extracted for analyzation. And so the really cool thing about radiomics right now is that there's an open source Python package that allows us to extract these quantitative features from imaging with the use of the Python programming language. So this means that almost anybody with a computer and some knowledge of the Python programming language is able to segment images and extract quantitative features for them that can then be analyzed by a computer. And so how are we able to analyze these quantitative features is through machine learning algorithms. And so here I have an example of just one of the hundreds of machine learning algorithms, and this is called a random forest. So based on a large data set, this random forest will ask a overarching question such as, does this tumor have X mutation? And it'll answer that question by asking multiple secondary questions. And in reality, we'd probably have thousands of questions or hundreds of questions that we'd ask. So one of these secondary questions could be like, is this tumor spiculated? And it'll go down to asking yes or no questions, trying to figure out if the tumor is spiculated. Eventually, this decision tree will land at a result, just like all the other decision trees will, about their own respective secondary question. Then all of the decision trees will have a majority averaging and voting session, which then they will decide as to whether the original question is true or false, which is, does this tumor have X mutation? And so the reason I explain this machine learning algorithm is because there are hundreds of machine learning algorithms, and to be able to adequately interpret these images and these predictions, we'll have to read these machine learning algorithms with a little bit of nuance so that we do not fully rely on the computer to make a diagnosis for us. We'll have to make sure that it clinically correlates and it makes sense, and we'll have to know how the machine learning algorithm arrived at that prediction. And so now that we know a little bit about radiogenomics, I want to go into a patient case. And so this is a 55-year-old man with no significant past medical history that comes into the emergency department because of 2 weeks of confusion, nausea, and vomiting, and left-sided deficits. And so in the emergency room, they get a CT scan on him, and they see this enhancing mass with central necrosis and surrounding edema with a significant midline shift. And so this leads us to a suggestion of glioblastoma. And so the next step would be to correlate with MRI brain imaging or to get a biopsy to confirm GBM. However, with radiogenomics, we're able to segment the image and take the area of interest and use a machine learning algorithm to analyze this image and extract the quantitative features through radiomics. And so after a few hours of tinkering with PyRadiomics, I was able to generate this table of 3 features from that image, which is texture randomness, intensity peakness, and tumor shape irregularity. And so these are the values that it came up with. And then I used 6 patients whose status was known, whether they had the IDH1 mutant or the wild type, and these are their values for the same 3 features. And then based on this data set, I ran it through a random forest, which was able to come up with a prediction that this is the IDH1 wild type. And so in reality, we'd most likely have hundreds of features that are extracted, and we'd be comparing this to thousands of patients. But for the purposes of this presentation, I just wanted to keep it simple so it did not get too complicated. And so regarding some of the implications of radiogenomics, as we continue to develop this technology, we'll be able to detect more imaging findings that correlate with histological or pathological patterns for other diseases other than just cancer. And so I was able to find this one very interesting study in Australia done on epilepsy, which they were able to use radiomics and radiogenomics to identify a dysplasia in the temporal lobe of about 11 to 12 children. And they were able to quantify this and characterize the lesion and able to perform an operation that cured these patients of their epilepsy. So this is a very exciting study that is kind of pioneering the modern field of radiogenomics. As far as patient care goes, having real-time molecular imaging of a patient is invaluable information. A lot of times we'll have to wait weeks for a genetic test to come back, and being able to develop this technology and reliably predict what mutation a patient has will be invaluable for physicians on the ground treating patients. In addition, radiogenomics allows for a comprehensive analysis of lesions, as well as decreasing the amount of invasive procedures that a patient might have to undergo. So in a biopsy, we may not sample the entire lesion, and we may not get a full characterization of the lesion just due to the nature of biopsies only taking a few pieces of the lesion. But with radiogenomics, we're able to get a comprehensive analysis of the entire lesion, as well as decreasing the amount of invasive procedures or biopsies for patients that may be extremely difficult in deep areas of the brain, like are seen in this image right here. Lastly, we'll have to consider that these data sets will become extremely large and have massive amounts of data information. And so if any leak happens, it could be catastrophic to many patients. And so we'll have to take certain precautions and practice excellent data stewardship in order to fully protect patients' privacy and their data. So that was my presentation on radiogenomics. I hope that it was helpful and that you learned something. Thank you.